signal when you're all ready.
103. Got it.
Okay. First item, we will call for approval of the agenda. Did everybody copy the agenda? There's some over there.
I move motion to approve the agenda. Second it.
And Madam Clerk,
Thank you. Oh, I was over there.
discussion, hearing none, motion carried. Approval of minutes of November 2nd meeting.
Make the motion to approve. the minutes.
Copy of that.
Second.
Motion by O'Connor, by
Ellie.
Kelly.
Grace.
Any discussion on the agenda, on the minutes of last month? Hearing none. Exposure, conflicts, don't see nothing. Public comments, Madam Clerk? Don't see anything. What's on the board there, Diana Peters?
She's supervisor in our department. She's just watching from her.
We're gonna have some comments from her.
No, she's just participating.
Okay.
As an interested.
Well, thanks, I'd
member.
like to see that.
We see, hold on, Mr. Chair. Did we see Fran up there? I don't see Fran.
He's not, no.
Okay, I'll check on her.
Okay, Fran, you wanna run that through?
Fran just said she wouldn't be able to be in attendance, so she would be on the phone.
And
on
she
her-
kind of.
Oh, here's someone, hold on.
Well, yeah, she had some keeping her down. She said.
Joe Demling, had
Here's,
to go.
here's Fran.
Thank you. Hi, Fran.
So we've got a report from Fran and Dr. Loggins and Joe.
Dr. Log is yet.
Yeah.
Going to call up.
Fran is online. Dr. Log is online yet?
But he has called in or somebody had that.
Come on.
So he's all right there. Number 7, Tanya, I'll turn that over to you. Upgrade regarding, COVID.
You giving the COVID update? Jean?
Would like to have the numbers?
I don't know if you girls even seen this. There was a bulletin just before I left on television and I watched this doctor, somebody, and Pfizer has came out with a pill that is supposed to be in production this month. That's supposed to be 89%. Saw that on the bullet. Go ahead.
Okay, well, I didn't prepare, so I don't have specific numbers for you, but, you know, we're seeing, and it's hard to say right now, we've been having issues with the state system on the reporting of the positive cases again. So seems to happen on the weekends. We're not exactly sure if it's accurate. Our numbers are going down, which is a good thing. But we haven't seen some of our bigger lab results coming through. So that tells me that something's not pushing through like it should be. So they're, you know, I know the state is working on it. We've been having troubles even logging in and getting into that state system. So I can't give you with confidence what the numbers are unless, Jean, you have numbers that you can confidently report for positive cases.
Last week for COVID cases was our all-time high since the first week of August at 357 positive cases.
Last week?
Last week.
Wow.
So on
Last week
average,
the system was working.
on average since August, we have been handling 238 cases, positive cases per week since the last week of August. So our cases, hopefully will start trending down, but it just really depends on how it's spread.
And is that all, are those numbers just Polk County residents? And then, but we do get some from Minnesota that come too, don't they, and get tested?
So these aren't just, these are anybody who tests positive that lives in Polk County.
That leaves
So
us-
even if they get tested in a different county, they'll come back to us in West.
Okay.
So our testing data doesn't necessarily reflect how many people are getting tested in Polk County. So they may work in Polk County and get tested, but that test result will go to either St. Croix County, Minnesota. It will bounce back out to their local jurisdiction to handle.
Should be a pretty broad section. That's all 3 strains.
Any COVID.
Go ahead, Tanya.
Can I just ask you a quick question? Do you record whether or not the cases, when you do the contact tracing or whatever, do you record whether they've been vaccinated?
The state, yes, there is, in that database that we talk about, there is a way to link it to their vaccine status.
Do we have any data on that?
State is gathering that. We would have anecdotal, so we would feel more comfortable using the state's data.
They don't have it narrowed down by county, it's just statewide
Well,
data.
how is the statewide for cases versus vaccines?
So right now, if you look at that data, they have it by like people, and it clearly shows that unvaccinated people are more hospitalized for sure, but there are more cases through unvaccinated.
They are more what?
More
Unvaccinated.
positive cases with COVID through unvaccinated, like they do. Vaccinated people can still have breakthrough, but the data shows that if you are unvaccinated, you're more likely to get it.
But of the positive cases, are more vaccinated or unvaccinated?
Right now, I would have to double check at the state. I don't have county level data. But it should be unvaccinated there's more positive cases of unvaccinated folks in the
Should
states.
be or it is?
There is. That's what the data showed that I looked at probably a month ago.
The other piece, I don't know if the state will track this, is we're kind of running out of our immune. We've got vaccinated.
Our
Some of us
immunity.
coming up. Yeah, so immunity. Just be interested if the booster data, like what that's showing, if the state will tell us that.
So we have so far gotten over 2,700 people boosted in the county. And with our new variant that is coming out, they're still in early development for data showing if being boosted or vaccine is going to help us in the future. But they do say statistically, if you are vaccinated, you are less likely to spread COVID.
And boosted.
Yes.
But they're able, I know at one point they only had one lab in the state that could test for Delta variant. And then when I talked to the state, they said they were trying to get one up and running in, I think it was Eau Claire, so they had a second one. Do they have labs in the state that they can test for this new one?
Yeah, so how that works is that if you want to test for the specific variant, that requires more specific testing equipment than just testing for COVID.
Yep.
So I'm not sure if they opened another one in Eau Claire. I know the state lab does it, and I know there's a lab in Minneapolis that does it. I have heard nothing about having another lab in Eau Claire because they have to, any lab that does that has to go through a very long process to get certified by the state and make sure their calibrations are up to standard. So
We
don't
really
know.
don't know if any of these cases here in our county are the new variant or not.
We do not know if we have the new variant. We have it detected in Minnesota and here. So it's just, we still have COVID cases regardless of the type. We just need to focus that COVID is still spreading through our
But
community.
they're not testing for the variants.
Every so many samples do go to the state lab if your testing site goes to the state lab. Like our testing site, our samples are sent to Mako in North Carolina. So they're not really being tested for a variant unless we specifically have an odd case of COVID and we don't know why, then we can make that request. But every so many, the state will automatically test for the new variant to see if there's anything present.
And the state where ours go will do that same thing?
Oh, no, not in North Carolina, not our test results, unless we
State.
specifically ask for it.
The state lab.
And the other day on the call, they said that the resulting might be slowed down because they are doing the sequencing in the state lab. So we might see a slowdown with the other labs coming back for the ones that go there. And we have seen a little bit of a slowdown, but I don't think that's related to, like Jean said, ours go up to North Carolina.
Just a quick comment. In Minnesota, the overwhelming cases are Delta. They are testing and they're saying it's much less than new variant. That's a milder illness anyway, but the Delta is still the big spread. And it's unvaccinated, essentially.
My brother and his wife live in White Bear Lake. They've had the two Moderna and the booster,
And they
and they
got,
both got COVID.
I know it's not exclusively unvaccinated. So, mild, I hope.
Yeah, they weren't hospitalized.
Okay, Tanya, good.
Okay, well, just
Good conversation.
with regard to the treatments that are out there, that the state is working on getting the prophylaxis for that it's called Evusheld. Very limited supplies for severely immunocompromised. So I'm not sure when that's coming into state. And then there's also the antiviral that will lessen the or the effects of having COVID, but there's a timeline of when you have to take it. It's like the Tamiflu for influenza. So that should be coming in to state as well. We don't have any details on that. The state is also looking at redeploying our Wisconsin National Guard to long-term care facilities and hospitals because of the demand that is being placed on both of those types of facilities in staffing shortages. So they are not able to care for the patients that need to be cared for. So they're looking at redeploying, moving National Guard from testing sites and vaccine sites to more hands-on skilled cares. I think more information is coming out on that this week. Locally, we are still doing the testing 5 days a week over at the highway shop, drive-through style. We're looking at changing that up a bit and adding different types of testing. So we're seeing people coming in wanting their test results right away. So we're exploring some options there. We still have vaccine clinics. We don't have any drive-throughs scheduled, mass drive-throughs scheduled for booster shots and or for second doses. They could come here on Tuesdays and Wednesdays. And I don't know if they are
Thursdays in January.
Thursdays in January, and you can get first dose, second dose, booster, flu shot, about any flavor that you want. So that's where we're at.
What are the Thursday hours?
I know we just posted it yesterday, so that's the only reason I know.
And we have, we are doing the age 5 and up.
Thursdays starting in January will be 10:30 to 6.
Appointments are appreciated, but we will do our best to get people worked into the schedule.
Is it a drive-through?
No, it's Monday.
Oh, it's down below.
Tanya, what's the number 8 in division update?
What?
Number 8 on our agenda, division update. I don't know anything about it.
Okay, moving on. So Vince, do you want to tag team that with me or
Sure.
division update? Okay, that's not, you're number 9.
It's here, Polk. Has everybody got a
That's
copy?
number 9. That's for number 9. That's for number 9.
Okay.
Yep. Okay, so as far as division update, you know, we just got budgets passed last month, so thank you all for that, all the hard work on that. We're fine tuning where people need to be and continuing to streamline our budgets. I think as far as where we are at with year-to-date budget, we're running a little bit lower in Department of Children and Families, seeing some more mandated services through behavioral health, probably effects of this long-term pandemic that we've been in. I don't know if you want to speak to that, Lisa.
Well, I think nationally, and we're seeing it here too, is just there's increase in needs for mental health and substance use services. You know, I'll just speak to, we have a couple of positions that are open and it is incredibly difficult. It's just really.
What position is that?
We have some therapy positions, clinicians, so therapists. And we've had that open, one of them open since September. That's all right, Tanya? And it's just, there's just no candidates, but it's not just behavioral health, as I understand it, through HR, it's across the county as a whole. So yeah, definitely been seeing increases in calls to our crisis line. Some of our adult protection calls have seen an increase as well.
So we're looking at how we deliver services, and maybe we need to change up how we deliver services because we cannot replace these positions. So it might look different. So we've got meetings scheduled to be able to walk through that and figure out how to meet the needs. Public health, you know, they're busy doing the pandemic response, but then they also, state is telling us we have to get back to normal work too. So I'm looking at how we have a COVID team and a regular public health team to be able to do those other things that public health. So.
Well, I think that's interesting, your experience with the calls, because the Attorney General just came out last week. I don't know if you saw that, but they had a mental health assessment of the post-pandemic. Maybe it was focused more in the teen and 20-year-olds, but they said that girl suicide attempts were up 53% in the pandemic. And so that totally echoes what you're seeing then. Oh,
And that's nationally. I mean, I talk with colleagues across the state and
that's what he's saying. Yeah.
and without individuals, professionals to help treat those folks,
Right.
that just has more negative impact. You know, and I should shout out kudos to the staff that we do have. They're really working hard and doing wonderful work. Covering things that they always folks in the community.
So Don, do we have mental health or therapy, or you got any comments on what happens over in the jail?
Well, we currently have a behavioral health nurse that comes over there and had a lot of picking up past month people that really.
I would agree. We've seen, yeah, Kathy Carter is our RN, and she's primarily been, if you might recall, we piloted a project for going over to the jail in 2019? Is that when we piloted that? Was super successful. And so, you know, basically she spends about a day a week over at the jail, and she's doing a number of things, taking in sick calls, seeing consumers, and prepping for our nurse practitioner, our psychiatric nurse practitioner, to see those folks for medication evaluation and management. So our nurse practitioner is in the jail half a day, every other week. So, and she's full. Definitely an uptick.
Yeah.
Just as kind of a side note, working on a project with the 8 schools in the county. And we're going to put a presentation together for the CJCC board coming in spring. What are the schools doing mental health wise, K-12? I've got the counselors working on that, Andy Brown and Mike Wilson, Andy from Unity, Mike Wilson from St. Croix Falls, are kind of my go-to guys for that. So we're trying to compile what they're doing in the county as far as students are concerned with mental health, stress, COVID, not being in school, etc. Then also as a side note to that, being involved in the Kinship program, Kara Lee over at Kinship has put out a program for Kinship Mentors. How Kinship Mentors can deal with their mentees when they're working with them. Of course, they're working with school-age kids. And so if you have a mentee that's not related to school, and it's kind of that, you know, it's almost like a step parent or a big brother or big sister, how can they relate to kids in a non-stressful way? So it's kind of interesting that everything is kind of coming together. But we're going to have we'll have some people coming in for the CJCC in the spring and making a report to that board as to what they're doing mental health wise.
And if I may kind of add on to that, you know, we partner a lot with the Mental Health Task Force of Polk County on pretty much any endeavor we can. And so we're trying to bring in, you know, question, persuade, refer, which is a training that provides background for lay folks on how they can question individuals, loved ones, family, friends, persuade them, and then refer them on to a provider. We also have had some mental health first aid trainings in the county. And then upcoming in February, it's something we do every year in partnership with the Amory School District. They have youth screenings for their freshman kids, 2 days in the month of February. And then we always have a clinician that's there. That's something we donate, we give. They don't have the funds to pay for somebody to be there. And so we will be participating in that again this year as well. So it's definitely a good
Well,
project.
Bill, that, you know, it strikes me, it's interesting that you're working with these 8 schools and training and that for Kinship. Just a a side note, I remember about probably 40 years ago.
Not that old.
You remember the name Clarence Johns?
Absolutely.
And Clarence was the head of the Polk County Housing, and I was a volunteer vice president. So the two of us went over to Hazelton for a training session. And we sat around in the room, even with each one tells their stories, and hoping they know that a story that somebody's got will turn on a light in somebody else's mind. But I remember some of the things very plainly that I learned in that training session. Sat with people. And the things that you can learn in these training sessions from professionals, something that'll make a mark in your life. And I think these young kids really searching for some light from some professional. Pretty interesting.
It's a very tough time right now for the teen and 20-year-olds.
It's
I have two of them, and I watch them and I watch their kids, their friend group, and it's hard out there right now. It's really hard. And that group that is getting the presentation, can they come here in the spring?
I'll have to talk to them, see if they want to come in here. I certainly would say
Or
sure,
a handout or something?
but I can't speak for them.
Yeah, just put it on your radar. to see if-
Absolutely, sure. Criminal Collaboration Council? Yeah, we have a meeting on Thursday
Mhm.
this week. The full board has a meeting.
okay, Tanya, you're still the boss lady.
Yes, thank you. So I do want to mention that economic support and business and operations, they're another couple of our units within economic support. They're getting ready to be back to normal with normal processing during the pandemic. The state government eliminated the need to verify certain things, so people could just get assistance if they needed it. And Diana's on, she can tell me when they go back to normal, but they are getting ready to see a pretty significant increase in their workload based on the going back to normal pre-pandemic times. She's gonna say something.
Yeah, so we're projecting that the health emergency will end for us probably March 31st of 2022. We've already started going back to some of our pre-COVID rules, which has increased our workload with reviews and verification of documents, that sort of thing. So April of 2022, we hopefully will be back to what we knew pre-COVID. So we are doing a lot of training with employees to help them circle back to policies that we had before the pandemic started.
Diana. And then Kathy, you're just budget lady, so
Well, I mean,
supporting
obviously,
the division.
yeah, with ES, obviously the front desk does do a lot of that work too with scanning the documents in timely and everything to the consortium. So been helping support with the other vaccination clinics and everything because they are going to be at our lobby here.
What happens with this back to normal if the pandemic is going on? What does that look like?
That's a good question. I don't know if they're planning on if they would extend it again or we haven't heard yet. So
Yet to be determined.
I mean, I think-
Time.
Yeah, it's been extended a few times for ES, so I would suppose they're going to continue to evaluate it and push it out farther if needed.
Yeah, for economic support, we've had a number of consumers that have been able to stay on, like Badger Care and medical assistance, for the last 2 years, regardless of their income. So we've seen a number of people that have found employment during the pandemic and has pushed them over our income limits, but they've been able to maintain their medical assistance in Badger Care. So for a number of them, once the pandemic ends in first quarter, a number of them are probably going to lose their state health insurance coverage and have to look probably at the marketplace or at insurance through their employers or the private sector. And then for our food share program, people have been getting the maximum allotment for their household size for about a year and a half. So as well, once the federal pandemic ends, those individuals will go back to getting a food share allotment based on their income and their household size. So a number of them will see reductions in the monthly allotments that they receive.
Thanks, Diana.
So the declaration, not the pandemic. Wish it was, the pandemic was over, but the declarations will be ending. Hopefully, we can do both, but, okay, that's all we have for division update. Do we want to?
And you want to move into number 9, this,
Sure.
I can do it.
It doesn't matter. I'll kick it off by just saying, if you look at this, I believe you have this on your desk.
And Kathy will pull it up on the board here.
In terms of a program review, when we got through with the budget just recently, and I'm always amazed at how much money goes through the community services division for various projects. So I asked her, for future planning purposes, show me a little bit of a history of how much we spend on certain programs and how it fluctuates. And this child and family services, you can see the green bars represent the expenses in a given year. Blue line represents what we budgeted. Now, obviously, great job by Tanya and her staff of coming in under budget. But go back and look at 2018. And what that means is that it's not uncommon for, in a given period of time, for certain children or circumstances come up where we are mandated to provide certain services where the expenses shoot way up. The next page looks at behavioral health. And the same type of thing. We're doing pretty well staying on budget. 2018 was a bad year. I don't know what was going on in 2018, but bad year in terms of we had a lot of expenses in providing services to people in need. And you can see this year, possibly related to COVID, behavioral health expenses are going up.
We've seen greater admissions to the mental health state hospital because there just isn't room in other hospitals that are local and where there's a shortage of that anyway.
Good. And so then the next page are the two combined to see how we do. And I think, the reason I wanted to look at this as well is, many times as supervisors, we're in a position where we say, oh, we're giving money back to the general fund this year. And by golly, would spend some of that money. And I just use this to point out that we know that there are capital expenditures coming up in the future. We know that there could be any of a number of emergencies such as storms or COVID or whatever. And we have to remember that years like 2018 are just right around the corner. It's going to come back and bite us. And that's why, in case people ask, why is it the county is putting money away? We have to, because you never know what's going to come around the corner. This last grid is simply a look at how much money is coming in to help us with, through grants and funding and so on to deal with COVID. And, I looked at this and I said, boy, that looks pretty good so far, that we still have $1 million left in excess to spend in our COVID areas. But that, you just don't know when COVID spikes again, when Omicron or the next one comes forward, and there's no guarantee. You just look at the economy. Who's to say the government is going to be able to keep providing this money, or at some point do they say, you know what, we're done? So it's a way to say thank you to Tanya and her staff for doing a great job of managing us through these expenditures. But two, it's great when we save money, but we have to be prepared for those years when expenses go up.
Glad to hear that.
I am also a rainy day person. I like having a little buffer and saving, and I would be curious, it'd be really interesting to compare these bar graphs with our costs. And I know this is an esoteric question, and our needs. Like, what are we seeing in the neighborhood, in the communities? What would the bar graph of need look like next to the bar graph of money. Do we even
So I
have?
can
anything
explain
like
the,
that?
the numbers a little bit. These are just the mandated services that we are required to provide. In behavioral health, it's more of your mental health hospitalizations. If there's not an insurance payer that'll pay, it comes back to the county responsibility. And what is it, $1,500 a day right now for mental health placement?
Yeah.
So that can add up really quickly. The state does the efforts to collect on those, and once they've done their due diligence, we cannot ask that person for money, so we have to pay. And the state extracts it right out of our allocations that come in. Sometimes it goes into another year. They want, like, we have an IOU, and we'll come January 1st when we get our state money, they'll extract what we owe them for the last year if we don't have enough to cover. So kind of a guessing game. You don't know what's walking in the door on any given day. And that's
Out the door.
or out the door. Yeah. And I think that the assumption with DCF, there's a couple of assumptions, like Vince mentioned. We've got good leadership in there, keeping numbers down, keeping track of placements. But then also I know that during the pandemic, we were not able to place a lot of kids because they wouldn't take them for COVID reasons. So that could be another reason why it's showing lower. Behavioral health, same thing last year. They weren't making placements. People were locked down. Now we're seeing that things opening up. We're seeing an increase in those placements. Leadership does a great job of making sure that they are discharge planning as soon as they walk in the door, so we can get them back out and back to recovery in the community. But when you have to keep somebody safe, you have to keep somebody safe.
Question, Tanya, how many RNs do we have on staff? On your whole picture, being the director, how are you staffed? Church or whatever, where are we at to start the year?
I know that we've got a handful of recruitments out right now. Lisa's got those clinician positions. We've got a couple of social worker positions. We've got a couple of nurse positions.
Yes.
And there's an economic support position. So a little bit higher than our normal, I think.
Also, to clarify, these grant chart expenses are just on like purchase services. It doesn't include staff time or services we provide in-house. These are just like placements, mostly placements.
Vince, you want to move into ARPA funds then? Stan?
Sure. And
Yeah, that was it.
I think,
Unless you had more questions.
just as a reminder, we've had discussions in executive and in general government where we talked about, I think Ms. Kelly's resolution will be discussed at the upcoming board meeting. If I can paraphrase for everybody, and you can correct me. If you recall, Ms. Kelly's resolution dealt with the microwave radio system, the extra tower in Taylor's Falls to help the St. Croix Falls area where there are blackout areas or gaps. It also mentioned the roof for the Justice Center, and it mentions the bell tower in at the museum. Since that time, some committees have expressed interest in, and this committee has talked about the older home for hospitalizations for public health and so on. And also the LiDAR software out of environmental services, which would be used to help 3D imaging and help in a lot of different ways there. Things to keep in mind are the pricing for the microwave system is guaranteed only till the end of this year. And then also with LiDAR, we got accepted for a grant. It's 134,000. But if we don't accept this grant and put it on in this year, then it will more than double in cost. So those are the items, and that, you know, it's so if I could speak for many people I talk to, I see a coalescing around the microwave system and the extra tower, because that deals with safety and law enforcement and so on. Then the question will be with the remaining funds, because we've already spent 1.62 or will spend for the recycling center. What do we want to do with Ms. Kelly's resolution, which can be amended or not.
Is the LiDAR grant coming before us on Tuesday for an acceptance of this?
Yeah, well, I think ARPA discussion in the Cal will be there. So if we discuss Ms. Kelly's resolution, which is on the agenda, some might suggest that there might be an amendment to it. It could be. I don't know if there will be. They could say we amend, take this item and off and apply, put the LiDAR on there.
So that's the only way LiDAR is going to get, the only way we can accept the LiDAR grant is by amending the resolution?
Well, or that's a good question. I think because it was going to be funded with ARPA, that would be the only way to do it now. Yes, because otherwise you'd have to put it on the agenda for the next month, and it would require a budget amendment.
So is LiDAR fully funded with grant money?
No, it's just over half. Yeah.
Okay.
So it's normally like 270, 80,000, and
You want to explain this LiDAR a little bit in case somebody and myself?
yeah, and I am not the person to explain it. They had a presentation at a couple of the committees. Basically, it is a aerial 3D photograph of our county, so to speak, where you can identify where every culvert in the county is. You can identify anything that might be relevant to construction, road construction. You can see setbacks. You can see the high water marks. And so the efficiency of it is, instead of sending someone from land information or land and water out to visually inspect something, so on, you can look at it and see where there's a lowland.
It's like Google Earth on steroids.
Oh, yeah, I
That's
can
what it's
expand
like.
on it a little bit. It probably about 2002, we contracted this, what they call flyover. And they flew over and they identified all the town markers in the county that the surveyor went out and identified all of them to fly over it. And we did pass that, and it turned out to be beneficial in millions of dollars. And
what,
that's about where we're at again.
and what they're talking about too would also be available to the public to use on our website.
Well, that's good.
So, well, it's, we had a lot of discussion on that because is it good or is it, how will people use it? But like Kim O'Connell being what he does for his business, it'd be very helpful for somebody like that, being able to help identify different things. But it's like Google, if you've ever done Google Earth, it's like Google Earth on steroids. It's a cool
You can
thing.
see heights of
Yeah.
buildings, heights of trees. You can measure volume of mining material.
Yeah.
Got piles of it. It can tell you how many yards.
Brought that comment up because I'd like to congratulate supervisors that are forward thinking and have forward vision. Because it's just an example, Polk County, we've got this reputation from what we've done. Turning down our tobacco money back years ago and all that. Supervisors that are forward thinking. Worse are we?
Just read in the paper about that. You just said about that Burnett County's getting a chunk of that $410 million.
And just as a reminder, when you think of ARPA funds, we got approximately $4.25 million deposited, which we can use pretty much any way we want to because of the revenue loss caused by COVID.
This time.
This time. In May, in theory, the next $4.25 million comes out, which we suspect it is. But it's not until March or so when we can begin calculating if So when you think about it, what are we gonna spend now versus what are we gonna spend later? The next round of funds may be more limited, how we can spend it. May not be.
And I think to add on to that, it's part of the COVID response too, is that pandemic is still around, we are required to respond. So, that $1 million can get eaten up pretty quickly. Hopefully we don't have to go there, but something to consider too is have to respond.
Pay fund for the COVID ongoing past the support that we may or may not be getting.
Which, I mean, the COVID response would be in one of those ARPA buckets.
Can you remind me, and I do have a quick question later about the command center, where are we at with that resolution? I thought it went through the board. How did that go again?
It was pushed out to the next board meeting.
Did we have it at our last agenda meeting?
Yes,
No, we did.
yes,
And
we
we
did.
kicked it down to
And we
the
kept
next.
it to the next meeting so that we could look at these other options. And I can tell you, personally, if I was doing the resolution today, I would do it somewhat differently than what I originally did it, just because I've learned more about Justice Center, roof, the command center, that type of thing.
What would you do? How would you tweak it?
I would like Vince said, I would leave the towers in, all the radio tower things. I think we should discuss like the command center, what do we do with, because the command center, if we want to do the command center, it's going to take 300 days, right, to get that thing ordered if we would order it. And so we don't have to pay all that money up front, I wouldn't think. So I wouldn't imagine we're going to have to pay that whole amount till it's actually delivered or thereabouts.
I think as long as we got the command center, Don has been down to the factory, and another person that's involved in this is Lisa McMahon.
Yep.
I met with Lisa on Monday morning.
Doesn't look like it.
She was on her just before she went to Madison. Right now, she's at 3-day training. And Don, you got some more information on that.
Yeah, so we picked out a floor plan and got a price.
Right down at the factory in Burlington.
I would not go in there. Do not go in there.
What's the price at now? We were at 550 the other.
So depending on if some little things like cable, upper between 540
Well, basically what you guys estimated before.
My concern around that was making sure that the command center is going to be able to do double duty so health gets what they need.
Yeah,
The police area gets what the emergency services gets what they need. So we don't spend $500,000 on something that somebody can't use. So that was, I am all for the command center. I think we just need to do what Don's doing, go down there and make sure that we're getting exactly what we need, working with both groups. The other thing is the LiDAR. I believe the LiDAR is a good thing to have. If you look at the long-term facilities improvement plan, the roof for the Justice Center is not today. It's on the plan for, I think it's 2025. So I would take that out. I would put the command center and the LiDAR in, and I would leave the museum tower in, because when we talked to, I think you asked Mo, if we had to do one of these two things, which one is in the most dire need of being repaired? And it's the bell tower. It's a lot less money, but we've been doing some things at the museum to really make it as part of our trying to be visitor friendly and whatever. The bell tower, if the bell tower goes, that's a mainstay of the building over there. So, and it's dangerous. You can't go up, you're taking your life in your hands going up in that bell tower. So I'd like to include that in there too. So that's my thoughts on it today.
Tanya, do we have any, public health, community services side of this command center?
Yeah, it will be multi-purpose.
Okay, and so are your staff working with these guys on exactly what it
Yeah.
looks like?
Yeah.
Okay.
Yep, that's why I feel comfortable at the point we're at now, that we've identified what each group needs to be able to use it appropriately, for the function they need it for.
So you'll be able to go out and do COVID shots in the far northwest corner of the county easily, and it'll be set up for what you need. And
I think what Bill expanded on that a little bit, Don did too at our last. The command center, if you look at our history, there's always going to be emergencies like these tornadoes and different things. And even, like in the storm of 91, there was people that were, we couldn't communicate with. And seen this week with the tornadoes and everything. Maybe we don't think that it's emergency right now. But I know even the command center that we did have, we communicated out of the three counties. That was the center for the three counties, and it was invaluable.
Yeah.
Just say, going to the county board meeting last month and making a presentation, support
On public
Sharon,
comments.
support your resolution, Sharon. I think it would be important for our board to, and again, to perhaps reiterate to the county board, I'm very comfortable with the resolution that you have. That was my point of going and supporting that. The idea that I had was to get those communication things in first, that microwave tower and that new cell tower in, because I think that's what's needed. That's a public safety thing. The second thing is that command center, if it's a multi-use item, then I think that that's important. The LiDAR that just came up, I was not aware of that. That's kind of interesting. But my point is, if you want to withdraw your resolution, reword it in what you just explained, I would certainly support that. I have no problem with that whatsoever.
I don't know if I can do that.
Yeah.
I think I would have to amend it.
But you can, but my point there is, at least Robert's Rules of Order, for my infinite short-term memory here, I think you can amend your own resolution or have somebody else do that.
Yeah.
And then if you amend it, then it can go through. I don't see a problem with that. But I would support that, just to say that as a board member.
Thank you. The other thing, now Don, I feel pretty good about that. That's kind of an offside joke. Anyway, one thing that, the way I understand it is, if, just so we're clear, if that building goes down for whatever reason, you can't, the Justice Center, and 911 calls can't go there, they will automatically route to Burnett, right? Barron. Barron. Oh, I'm pointing the wrong way. Yeah, Barron County. I knew it was the B. They will not route to the command center. Barron then our dispatch will go to the command center, and Barron will then contact our dispatch to send people wherever they need to go. Just getting a new command center is not having the 911 calls route to the command center, because my understanding that's cost prohibitive, because it takes a lot to have a 911 system put in, and it wouldn't matter if we had to put in a different building or the command center. It's out of reach. Is that right? Okay. Yeah, just so we understand that.
I think one of the things that we discussed is as 15 supervisors start putting a pecking order on what their priorities are, keep in mind that command center, we think, would be eligible with next year's money, even if they say it has to be related to public health or COVID, so on. So spend it this year, and that's just the way I think. If you think it, spend it this year, and then next year you're limited, then we're going to be scrambling to find, which case got to be related to infrastructure, COVID.
Which was my point with putting the Justice Center roof in, because we wouldn't be able to get that in the next 4.2 unless we could move it to the general fund. And we don't know that we can do that. But command center would fall right in to what ARPA funds are okay with. So it's a kind of a
Functional.
So it's going to be a discussion, I think, I think we'll end up talking about, do we do the command center right now and spend out of this 4 million, or do we put it in the next 4 million?
One thing I'm enthusiastic about, makes a big difference. This Thursday, again, if anybody wants to, come in, I've got a steering committee with the Wisconsin County Association. We're getting Chris's office Thursday at 10 o'clock, and we'll be on Zoom. I'd be the only one to talk to him. And I've been live. I've been to Stevens Point and was personally at all. And mentioning this, holy cow, people can't realize that we got this command center. And I think that when this comes in a Wisconsin public auction, which I think we're going to get a lot of money for our command center, much more than what we realize. I would just bet
So
on. Dr.
there's
Vames,
things to think about.
where are we at here on your agenda?
The
What is it? Finishing up going into the work plan and
Right, so we put the draft work plan together, always subject to change as different topics come in. If Mr. Oliva has the school guidance counselors come in, we can add that. We usually do it month by month.
if we have anybody come in outside of public comments, though, they've all got to be cleared through our administration.
We talk about the meetings ahead of time, so Vince is aware of what's coming in. So we just have the standard updates that we do with timelines for budget hearing and all of that kind of stuff. We inserted those, put together a tentative schedule for 2022.
Anybody else got any ideas of our work plan? Contact Tanya. She'll be drawing up our agenda for next month. I will tell you that I won't be around for a while. Take some vacation, 5 days, 10 weeks. Come next meeting, who's ever here, Joe and I'll probably be gone. If I'm here on Zoom, so it counts as a meeting, but so it does also count as a quorum, won't it?
If you're here on Zoom, yes.
Well, I'll always try and be here on Zoom. That out. And so who's ever here live, you appoint somebody to just.
We'll get back to you on whether you can appoint them or if they have to come next. I think.
I would imagine as administrator, you can appoint somebody to chair the meeting. That'll work all right. And then typically, I'm hoping in February, we didn't have a meeting in February last year. We never used to have meetings throughout the county in February. including the county board, but a couple of years there's COVID, and there were some things on the agenda that never happens in the future. We shouldn't have to have a February. Anyway, that's kind of the update on that. Appreciate the concern of everybody.
We'll finalize the 2022 work plan, Board of Health and Human Services accomplishments, what you guys were able to accomplish in the last year. There's also a satisfaction survey. And back, a couple months ago, we sent a bunch of people down to Tennessee, Nashville, for Drug Endangered Children's Conference, and they got a lot of information. So we want them to come and present to this committee on what they learned and how they will plan to implement it here in Polk. Look at that. And then John, Chair Bonifaz, you're always good about the legislative events or keeping us data on
Yeah,
representation that you
I'll
do.
be on top of, I'll make all the meetings on.
It's good.
We have CAFO update on here. The first 3 months. Oh, that's 2021.
Yeah, this is, yeah.
I didn't turn the page.
Last two pages.
Sorry.
Give me a heart.
Yeah. I knew it was me too. I was like,
We took CAFO and COVID off.
Yeah.
Update as needed. It's just not a standing agenda item anymore.
COVID will be,
So it's done, yeah.
hopefully,
We're doing the power of suggestion here.
oh, thank you. You're such an optimist.
Yeah. January 1st, done.
Well, wish everybody Merry Christmas and Happy Holidays, and it's been a great year for open discussions and participation, and I appreciate that.
Want a motion to adjourn? I move.
I second.
You guys are running the questions today.
You got them all. Got that, Madam Clerk? And you're welcome to be our clerk.